Tumor embolization. February 2012. Narrator and surgeon Dr. Michael Horowitz. We'll be treating a skull-based tumor with embolization prior to resection. A wire and catheter are advanced from the femoral artery up through the aorta. The catheter has been advanced and will be advanced now into the right common carotid artery. A run is done confirming positioning within the artery, and the tumor blush is seen. The tumor blush again is seen. This is a very large skull-based tumor. Here a wire has been advanced into the right external carotid artery. A catheter will be advanced over this wire into the right external carotid artery. Through this catheter, a small microcatheter will be advanced. The microcatheter will then be advanced into several individual vessels coming off of the external carotid artery feeding the tumor. Here we see one of those vessels feeding the tumor with a tremendous tumor blush with contrast and blood. The first microcatheter will be advanced out into one of the blood vessels that is supplying the tumor. It is advanced over a small micro wire. The wire will be removed. A superselective arteriogram is performed in this vessel that is feeding the tumor. We'll now inject Onyx 18, a liquid that turns into a spongy solid as it hits blood. The onyx will appear black as it enters the bloodstream and permeates the tumor. Here we can start seeing traces of it entering the blood vessel and the tumor. It will become more evident as more is injected. We are filling the different blood vessels of the tumor and the blood vessels that supply the tumor so that the tumor has less blood supply to it at the time of resection. This makes resection safer and easier. Here we see the tumor being filled up with Onyx 18 as the onyx enters the blood vessels to the tumor and blocks them. The onyx is being injected slowly so that it can travel deeply into the blood vessels of the tumor. Notice that the density is increasing as more onyx is injected and more of the tumor and its blood vessels are being filled with the material. This catheter will now be drawn back and will be advanced into another blood vessel that is supplying the tumor. The tip of the catheter is being withdrawn backwards. It is now advanced into the next branch. We see it being advanced. Additional onyx will now be injected into another section of the tumor. This onyx is traveling through the arterial system to permeate the tumor's blood vessels. As those blood vessels are blocked off, the tumor will get less blood supply, making it easier and safer to resect. Here we see the onyx traveling out into the tumor. Once we have completed treating this blood vessel, the catheter will be removed. A fresh catheter and wire will be advanced into another blood vessel that is feeding the tumor. In total, for this case, 6 individual blood vessels were treated that were supplying the tumor. We will only show the embolization of these 2 vessels. Notice as the onyx is injected, more and more of the tumor is filling with the material. Once again, the onyx is being injected quite slowly so that it can travel out into the distal aspects of the tumor's vasculature. The catheter has been drawn back so that we can embolize additional small branches of this blood vessel. Here, additional onyx is being put in and more of the tumor is being filled. All of the dark area here represents onyx within the tumor. This final image after all blood vessels were embolized shows significant reduction in blood supply to the tumor. The dark area represents the onyx that is within the tumor.